The pupillary muscles. How many types of pupillary muscles? There are two types of pupillary muscle. The constrictor pupillae and the dilator pupillae. The constrictor pupillae constrict and dilator pupillae dilate the pupil. The constrictor pupillae are supplied by the third cranial nerve, the oculomotor nerve, which relays in the ciliary ganglion and constrict the pupil. The dilator pupillae is supplied by the superior cervical sympathetic ganglia. Differential diagnosis of miosis. We know that it is caused by oculomotor nerve, which relays in the ciliary ganglion. The miosis is caused by morphine. Morphine poisoning causes bilaterally pinpoint pupil, but pethidine does not cause pupillary constriction because its structure resembles anticholinergic drugs. Number 2, acetylcholine causes miosis, a pupillary constriction. Pilocarpine also causes this, and all the parasympathomimetics, haloperidol and thioridazine, they cause pupillary constriction. The organophosphates, for example malathion and parathion, they destroyed acetylcholine esterase, and their side effect, their overactivity causes parasympathetic activity, in that is increased salivation, increased lacrimation, increased urination, diarrhea and emesis. And also the pontine hemorrhage, it causes the pupillary constriction. ARP, Argyll-Robertson pupil, in which the accommodation reflex is present and the light reflex is absent. It occurs in syphilis, diabetes mellitus and vitamin D12 deficiency. Aedes syphilis, in which the accommodation reflex is present, but there is mydriasis which is followed by miosis. The Aedes people is a tonic people. A tonic pupil means that when the light is thrown on the pupil, it constricts sluggishly. These people, there is an absent knee jerk, and usually it occurs in diabetes mellitus and sarcoidosis. Horner syndrome. In Horner syndrome, there is meiosis, ptosis, anhidrosis, and anophthalmos. The Pentecost tumor of the lung also produces meiosis because the sympathetic nerves from the cervical area, they are damaged, leaving the third nerve action unopposed, so there is pupillary constriction in those cases. The diagnosis of Horner syndrome is done by installing cocaine in the eye. Cocaine does not cause mydriasis due to the lack of sympathetic noradrenaline in Horner syndrome, whereas in normal people it will cause dilatation of the pupil. Third nerve palsy, there is ptosis, but it is with mydriasis or normal pupil. The ptosis in third nerve or oculomotor nerve palsy is due to the levator palpebrae superioris muscle paralysis, which is supplied by the oculomotor nerve. The oculomotor nerve supplies all the muscles of the eyeball, but it does not supply the lateral rectus, which is supplied by the sixth or abducens nerve, and the superior oblique, which is supplied by the trochlear nerve. The trochlear nerve exits from the brain stem dorsally. The action of the superior oblique muscle. Superior oblique turns the eye downwards and outwards. But if the nerve is paralyzed, it pulls the pupil outwards and a little medially. Fourth nerve is paralyzed, that supplies the superior oblique, or the superior oblique is paralyzed. Then there is vertical diplopia, and there is difficulty in reading, looking downwards and going down the stairs. And the diplopia in superior oblique paralysis increases if the head is tilted towards the side of the palsy. The fourth nerve is particularly injured in closed head trauma. The muscle supplied by the oculomotor nerve. Apart from the extraocular muscle which it supplies levator palpebrae superioris muscle and also the ciliary muscle. The contraction of the ciliary muscle increases the lens convexity, and that is the accommodation for the near vision. The ciliary muscle, when relaxes, it decreases the lens convexity and focuses for the far vision. The test for the levator palpebrae superioris muscle. The patient is asked to close the eyes, and then the examiner tries to open the upper eyelid. If the nerve is paralyzed, patient cannot keep that closed. The other extraocular muscles. Inferior oblique pulls the eye upwards and outwards. The superior oblique, remember, it pulls the eye downwards and outward. The recti, both superior rectus and inferior rector, pulls the eye medially or adduct the eye. The superior rectus pulls the eye up, it elevates, and inferior rectus depresses the eye. What is consensual light reflex? Consensual light reflex is when light thrown on one pupil, it constricts the other pupil. How does it happen? When the light is thrown on one pupil, the impulse is taken through the optic nerve, the second cranial nerve, to the tapetum in the brain, and from there the impulses go bilaterally to the arender-Westphal nucleus of the third cranial nerve. So the impulse coming through the optic nerve in the brain, and then it goes bilaterally to the nucleus of the third cranial nerve, and then it goes back to the pupil to constrict on both sides. This is consensual light reflex. The pupil does not respond if there is no light perception. If second nerve is partially damaged, or if the retina is damaged, the direct light reflex will be slower than the consensual light reflex, and this is known as Marcus gun pupil. When the second nerve is damaged, the direct light reflex is slower than the consensual light reflex, and this is known as Marcus gun pupil, and it occurs in retrobulbar optic neuritis and optic nerve diseases. Syphilis, where there is Argyll-Robertson pupil, in ARP accommodation reflex is present, but the light reflex is lost. In neurosyphilis, pretectal nucleus is said to be damaged. That leads to absent light reflex in ARP. Causes of Horner syndrome are brainstem stroke, sympathetic chain tumor, or it may be idiopathic. Syphilis, where there is accommodation reflex is present in Argyll-Robertson people, the Romberg test is also positive. What is Romberg test? The Romberg test, there is the proprioception. The position sense is lost. The patient is asked to stand with 2 feet together, and then when he closes his eyes, he sways to a side or falls. This is Romberg test and is due to the damage in the tectum.